Hi, this is Jon Burroughs, President and CEO of the Burroughs Healthcare Consulting Network, and I'm going to talk to you right now about common misconceptions about palliative care. Now, many people consider palliative care to be the equivalent of hospice care. It's what you provide someone in the last 2 to 3 weeks of their life to alleviate pain, suffering, to provide support to the family, etc. And whereas palliative care may include those elements, it is much, much more. Fundamentally, what you need to be able to do is to risk stratify a population of covered lives, such as Medicare, Medicaid, using predictive analytics. And when you locate the top 1%, that's 1% of people who make up your greatest risk and your greatest cost, and typically these are people with life-threatening conditions, you would provide them with comprehensive disease management services through a team-based approach. You would have a physician, a nurse, a risk manager, case manager. You would have a care coordinator. You would have a pharmacist. You'd have a spiritual advisor. You'd have a social worker. You'd have a home health care representative, et cetera, et cetera. It'd be a comprehensive team approach. And let me give you an example. Say a little girl is diagnosed with cystic fibrosis at the age of 3 years of age, and this is considered for her a life-threatening condition. You would provide her with palliative care services that day, not wait until she's 30 or 40 or 50 and is in a terminal phase. Why is that so important? You get the greatest cost and clinical advantages from providing palliative care early rather than late. Unfortunately, most Americans consider palliative care as a substitute of hospice care. They provide it at the end of life when it really doesn't provide any significant cost or clinical advantages. So palliative care is really a misnomer. It should be called intensive disease management because that's what it is for people with life-threatening conditions as determined by predictive analytics. Thanks very much, and I look forward to speaking with you again soon.